coming up on the Doctor's Hospital podcast.
So if A1C, this blood test, is 6.5% or more, you have diabetes.
In the Bahamas, diabetes is the 5th leading cause of death and the 7th leading cause of death worldwide.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctors Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Hello, everyone. My name is Eddie Russell, the Learning and Development Specialist within the Glow Initiatives Office, the Hospital Wellness Solution, and welcome to the Doctors Hospital podcast, where we connect public health interests to what we do in the Doctors Hospital system. November is recognized as National Diabetes Awareness Month, and in this month, we shed light on this condition, that affects millions all over the world, and specifically in the Bahamas. Today in studio, we have, joining us virtually, is Dr. Janette Martin. She is the Director of Weight Loss and Chronic Diseases and Diabetes Education within the Doctors Hospital Health System. Welcome, Dr. Martin. And we also have joining us Dr. Ariane Davis-Simmons, who's an endocrinologist. She will go into exactly what her role is in the management and the significance of it later down in the podcast. But I would just like to welcome you both to the podcast, and thank you so much for joining us.
Thank you for having. Happy to be here.
You're welcome. It's a pleasure to be here with you, Eddie.
So we're going to jump right into it. And I think Dr. Ariane Davis-Simmons, we're going to start with you. And I just want to talk about what are the symptoms of diabetes and how might they differ between type 1 and type 2?
So when we talk about diabetes, type 1 diabetes is autoimmune mediated, which means that the body is attacking the cells that make insulin. Those are the beta cells. Classically, we think of this occurring in children, but it can really happen at any age in life. These individuals will always need insulin as their therapy or part of their treatment plan for diabetes management. Type 2 diabetes is very much multifactorial. It is more common in individuals 40 and over. But again, with increasing obesity, we're seeing it develop in even childhood. So with type 2 diabetes, there are kind of three main components that happen. So one, there is usually increasing insulin resistance. You have relative insulin deficiency. So you're making it, but you're not making it enough to control the blood sugars. And then your liver is also making too much sugar over time. So those are kind of the three classic things. It's a lot more complicated, but that's the three basic things that happen.
Okay.
So risk factors for type 2 diabetes is going to be family history. So if you have one parent with type 2 diabetes, you're about a 17% increased risk of getting it. If you have two parents with type 2 diabetes, you're nearing up to 50% chance of getting the disease. When we couple this with kind of poor lifestyle, so obesity, overweight status, high cholesterol, hypertension, sedentary lifestyle, having women who have polycystic ovarian syndrome, these are all risk factors for type 2 diabetes.
Is it possible, and do we know if there's a larger number of women with diabetes than men, or is it's non-discriminating?
Yeah, it's non-discriminating. So with type 2 diabetes, kind of the risk factors I talked about, but there's no predominance with men over women. We may see a little bit more women in the Bahamas because they seem to access medical care more readily than men. Men are usually dragged kicking and screaming. And usually when they come, the disease is a lot more progressed.
I know I've noticed that in clinics, men are very reluctant to step in front of a doctor, particularly if it's something that is as serious as this. And I know that diabetes is not something that can be diagnosed as, say, uh, a prick of a finger to test one's blood sugar level. But how is it diagnosed so that people know exactly how to, when, if they have any scares or any concerns, how is it diagnosed?
Okay, so you did ask a question about symptoms, so let's talk about that.
Mm-hmm.
So symptoms of diabetes are related to the high sugars, and the symptoms can present the same in type 1 or type 2. So increased thirst, increased urination, unintentional weight loss. And when sugars are elevated, you can have blurry vision, maybe cuts or wounds that don't heal. If you've had diabetes a long time and you don't even know, you can have symptoms of numbness, tingling, hands and feet, generalized itching, etc. So when we talk about diagnosing diabetes, it's usually done through a blood test. So you can have an A1C, which is a hemoglobin A1C that assesses how much sugar is bound to the hemoglobin, which is a protein in the red blood cells.
Okay.
So this should be included in most annual visits, so at least once a year in our population because it's so prevalent, type 2 diabetes. So that's within a blood test. So if A1C, this blood test, is 6.5% or more, you have diabetes.
Okay.
If you have blood sugar of A1C of 5.7 to 6.4, then you have prediabetes. Okay. A1C of less than 5.7% is normal. If you went to have routine blood work for something else and they did kind of any chemistry panel and they found that you have fasting, so first thing in the morning test, and the blood sugar is over 126, then it's likely that you have diabetes. If you have a random blood sugar over 120, a random blood sugar over 200, then that is also concerning for diabetes.
Okay. Oh, there's a lot of things to process in that little moment. So, Dr. Martin, I want to shoot this one over to you. Can you provide an overview of the current statistics of diabetes in the Bahamas and any trends that you've been observing in your work?
Sure, I would love to. Diabetes in the Bahamas is on the rise. It's on the rise among adults and with children. Presently, the latest results that we have here in the Bahamas is 1 in 7 Bahamians are living with diabetes.
That's a lot.
And 7 out of 10 of those persons are newly diagnosed with type 2 diabetes. They're either overweight or obese. Essentially, type 2 diabetes is a lifestyle chronic illness. And so we could avoid being diagnosed with type 2 diabetes just through lifestyle changes. Now, in the Bahamas, diabetes is the 5th leading cause of death and the 7th leading cause of death worldwide. And these statistics come from the World Health Organization. So those are the trends that we're seeing in the Bahamas. And in our practice here at Doctors Hospital, I'm seeing these numbers match the trends that I'm seeing here at Doctors Hospital. What we're also seeing, Dr. Davis and I, is that we're seeing younger children being diagnosed with this lifestyle type 2 diabetes. And so we're seeing younger children in their adolescent ages who are either overweight or obese, and they're being diagnosed with type 2 diabetes.
When you say younger children, what ages? You said adolescent. Are there any the demographic? Does it go below that, or is it just that's kind of like the peak?
That's kind of like the peak, anywhere from they move out of puberty into like age 10, 12, moving into adolescence. Usually the children are around 13, 14. But we are seeing some overweight pubescent children who are younger than 13, 14, and they have type some of them are diagnosed with type 2 diabetes, but we're seeing the trend rising among our adolescents who are overweight or obese. And so not only are we being faced with this trend with adults, we're seeing it in children as well in the Bahamas.
So, for someone generally who has been diagnosed with diabetes, what initial steps and advice would you offer them so that they can adjust? And I think I also want to talk about the management of that.
Sure. Yes. Usually, when a patient comes to me, they're referred by one of the clinic doctors here at Doctors Hospital in the Centerville Medical or Carmichael Road, or I go to Freeport as well and see patients.
Okay.
And Dr. Davis-Simmons usually send her diabetics to me as well. Usually, as a diabetic educator, we encourage patients to know their numbers, and what those numbers are. Those numbers are inclusive of blood pressure. It is important for them, one, to know what their A1C is, and that's the glycosylated blood sugar. So their total blood sugars, and know what their A1C is.
Right.
But as a diabetes educator, my goal is to know, to inform persons of the importance of knowing the numbers, and that's their A1C, their morning blood glucose, fasting glucose, encourage testing, self-care. And self-care for a diabetic is 90% of taking care of their diabetes diagnosis. And that also includes knowing what their cholesterol levels are, their blood pressure is. Having an eye exam once a year is extremely important as well, because it's important to know, the health of your eye and whether the progression of the disease has impacted your eye health. Also, one of the areas that we stress with diabetics is for them to check their feet on a daily basis.
Right.
In the morning, once they come home from work and they take their shoes off, and when they take a shower, to make sure their toes are dried, not to walk bare without shoes outdoors. Look for cracks and swelling and dry skin, to be very careful with feet care. Why? Because the blood, their nerves in the feet are extremely, are impacted with type 2 diabetes. Their dental health is extremely important as well. And for them to have a checkup at their dentist twice a year and have their cleanings, and for their dentist to check their gums during those 2 visits. Immunizations is also key, because we want to keep their immune health up, so that they don't get the different illnesses that are out there, or to, protect them from pneumonias and the regular flus and COVID-19. So immunizations are extremely important. And if someone is smoking, we ask them to quit immediately, because smoking also breaks down the immune health, and it breaks down the health of the lungs. So self-care is 90%. Is 90% of what helps a diabetic control their blood sugars, and also taking care of their overall health. Now, when a patient comes to me, also, I take a nutritional history, because it's important for patients to look at the types of foods they're eating in regards to the carbohydrates.
Right.
Because carbohydrates is the body's main fuel. But carbohydrates elevate the blood sugars during digestion. So the type of carbohydrates they're choosing is essentially important to their overall blood sugar monitoring and their overall health, and especially too if they are overweight. So blood glucose monitoring first thing in the morning, fasting, and then 2 hours after eating is important. That determines whether they're eating the right and carbohydrates, or if they're eating the starchier and more sugary carbohydrates. Physical activity is another component of diabetes education that I work with patients with. And I encourage them to get active 5 days a week, 30 minutes. The World Health Organization and the World Diabetes Organization recommends 150 minutes of exercise per week. And that is really only 30 minutes of exercise per day. Managing their stress is extremely important because if someone is walking around on a regular basis and they're highly stressed, that can influence their cortisol levels and influence their overall health. And being knowledgeable about their medication, especially if they're on insulin, they need to know the amount of insulin to take, how to take that insulin prior to eating, and then bedtime insulin. So it's important for them to know all of these aspects of their health when they're diagnosed with type 2 diabetes or even type 1 diabetes.
It seems like having diabetes or being diagnosed with diabetes kind of speeds up, or rather, it intensifies the need for one to take care of themselves. Because had they been doing it beforehand, and we're not placing any guilt on anybody, because sometimes we just aren't aware, because there are so many stressors, there's so many things happening in life, and you just might just possibly get diabetes because of, just the unawareness. And I love the word self-care because it talks about a deeper sense of self-awareness. And I always believe that once you have self-awareness, you're kind of aware of all the things that's happening within and around you. So I love that you said that self-care really can create this space of perfect or near perfect management for the disease of or the condition of diabetes. I wanted to touch on what the community and family support, what role does that play in the management or just the treatment of that? Because I having worked in a hospital, I know that sometimes people heal better when they're at home, and healing happens not just through doctor patient communication and relation, but it also happens and comes about rather because they're around and they're supported by family and friends who want to see them get better, who want to see them grow and heal. So what part does the community, and this the wider community, and also family support play with individuals in managing their condition?
Family support, that's a very good question. Family support is key. And family for everyone looks different. Okay.
Right. Yes.
Yeah. Because sometimes some persons are not married, or some persons don't have a significant other, and so their friends become their family.
The chosen family.
That's right. So support care is extremely, extremely important in diabetes care, especially if the patient is on medication and they don't understand their medication, or they're taking multiple types of medication for not only diabetes or high blood pressure, and just to have that support system to assist them with navigating the illness. Yes. And, meal prep, encouraging them to get outdoors, to exercise. A social life is extremely important because, quite frankly, if you're diagnosed with type 2 diabetes or type 1 diabetes, it is important to maintain a social life. So with diabetes eating, you could pretty much eat just about anything, but you need to be able to understand the types of carbohydrates.
Right.
And I keep going back to carbohydrates because that's the fuel for the body. And so to determine the types of carbohydrates that will not affect your blood sugars rapidly is important. And then choosing the type of support system or having that support that will keep you active.
Right.
Because research shows that once persons have that support and they're socially active and they're moving about, it helps to bring the blood sugars down and control the blood sugars and the fluctuations in blood sugars and their weight as well.
I know we could all use care and family and community support. But I want to touch on something. I actually want to speak to your role in all of this, right? At Doctors Hospital, you are our diabetic education specialist, and you are also the director of weight loss and chronic diseases. And I want to talk about this service that we provide here at Doctors Hospital. So so just to answer the question directly, what role does education play in diabetes management? Because when you know better, you do better, as Maya Angelou has been quoted as saying. So what role does education play in diabetes management, and how can individuals kind of better educate themselves about their condition? And then we can kind of segue into what you do.
Okay. As a diabetic educator, I'm the bridge between the patient and their healthcare team.
I like that.
So I'm the bridge the key support system that the patient needs, because I help them to understand and to make sense of the condition that they've been diagnosed with. So when they come from Dr. Davis-Simmons, she would have done an excellent job of explaining to them what she's found in their blood sugars and their A1Cs and why they are now diabetic, either type 1 or type 2. And then she would explain to them the medication that she placed them on and then encourage them to see someone like me.
Right.
I'm their bridge because I offer the comprehensive education on various aspects of managing their illness, beginning with the self-care and all those other components that I mentioned, the proper nutrition, the importance of regular physical activity, the importance of maintaining and adhering to their medication and the doses and the time, monitoring their blood glucose levels, fasting and post meals. And in some cases, if they are on insulin therapy, they must monitor that nighttime blood glucose as well. Coping with the emotional aspects of living with a chronic condition. It's extremely important, the role that I play. And answering questions, being available to them, to the patient, is extremely important. So my role, I play that key role in support, as a support and bridge to their healthcare provider. In this case, Dr. Davis-Simmons and other physicians.
Do you provide? You said that you provide the education, and where should their mind be? Because you know that you said earlier too that it can be difficult and it's overwhelming. It can be overwhelming. What other spaces services are you provide within your space, within doctors?
Yeah, okay. In the space here at Centerville Medical Center, and my role as the director of chronic illnesses, obesity management, and diabetes, I work as the obesity specialist alongside Dr. Davis-Simmons as well, because she's an obesity specialist. But my role is more behavioral. I work from a behavioral side with the obesity management and an educator as well. And the support comes in as well. As you would have heard me mention throughout this session, a lot of our diabetics are overweight or obese. And so to couple the obesity management alongside their diabetes education is what I do. But if patients don't have the chronic disease of type 2 diabetes or any other condition and they're obese, I work with them with the nutritional component the exercise component, but I focus a lot on their emotional wellness,
Yes.
Their understanding of obesity and how obesity, if they don't have any chronic illnesses other than obesity, how it could lead to insulin resistance, prediabetes, diabetes, or hyperlipidemia and those conditions, and why it is important to address the overweight or the obesogenic state that they find themselves in. So mindfulness activities when they're changing those behaviors, reframing negative thoughts, and encouraging them to stay active, to stay in the process of the behavior change, and helping them to understand that changing behaviors are not easy. Nonetheless, with the support of a person like myself, then they're able to navigate those changes a little more easily.
I love that there's a heavy mental health component that I sometimes find that is kind of missing whenever we talk about diabetes. It's always, don't eat this, move your body, get the support. But I love that you are also incorporating a heavy mental health, component, and I think that's really important. I have another question, and this is in regards to developments in research. Dr. Ariane Davis-Simmons, are there any new developments in research in diabetes care that you find promising, or are there any new studies, even locally, that we can kind of reference with regards to diabetes?
Yeah, so diabetes research is growing exponentially.
Right.
Okay, so when we talk about technology, there is tons of diabetes technology that are on the market that help you to care for yourself better.
Right.
So you have continuous glucose monitors, which are devices you wear, you put on yourself, devices you wear for either 7 to 10 days, depending on the model, which samples your blood sugar every 5 minutes, and it can send it to your smartwatch. It can send it to your iPhone. So you know what your sugars are doing all day. It can alarm when you're high, alarm when you're low. So it keeps you safe. It helps assist you in dosing your medications, especially if you're on insulin. They have insulin pumps out, which administers insulin, and then are smart devices that can talk to the sensor. So it takes a lot of the everyday burden of decision-making away in terms of how to dose the medication. They have, so that's just on the technology side.
Yeah.
And there's always new sensors coming out, new technology. When we talk about medications, I want to say diabetes medications is a booming field. Because now the thinking is that, especially in type 2 diabetes, 90% of them are obese. So we know obesity, overweight status is driving a lot of the disease process. So the new meds on the market are targeting this diabesity, where it's not just, it's causing weight loss. And then for some individuals, it's leading to remission of the diabetes through the weight loss, normalization of blood sugars. These meds help with reducing risks of heart attack and stroke, reduces the risk of going on to develop kidney disease, things like that. So I would say it's tremendous change, and is very promising in the field of diabetes research.
So it is not a death sentence, because I feel like
of course
once
not.
someone receives any diagnosis of any kind, we talked earlier about having that mindset of worry and gloom and doom, or some people, like you said, take it by the bulls, take the bull by the horn, and then they ride it. But I think I think what's important and helpful for people to know is that it can be managed, it can be a part of your lifestyle, and it can be reversed. Would that be correct in saying?
So I usually say go into remission. So, because when we say reverse, people think you can never come back.
Okay.
So if
remission,
remission. So if you have type 2 diabetes and obesity and, metabolic dysfunction, and you reverse the obesity, meaning you lose significant amount of weight, studies have shown that the diabetes can go into remission. However, if you have weight regain, the diabetes can reoccur. So We've seen this in all actually the bariatric surgery studies, is that obese individuals with type 2 diabetes who've had type 2 diabetes for 7 years or less, and they go and have the procedure and lose significant weight, but more than 80% of them diabetes will go into remission. So we have lots of data to show that.
Oh, lovely. All right. I think with this conversation, we kind of hit all the marks. Dr. Martin and Dr. Davis-Simmons, thank you so much for sharing your insights with us. Is there a way that we can, or you can be reached, so that anyone who's listening to this podcast can reach out to you for any information or for even treatment?
Okay, great. So I'm part of the Doctors Hospital family. So I am working out of Centerville Medical Center, Doctors Hospital, on Mondays. And then I also do 2 Saturdays a month, the second and third Saturday every month. And I work very closely with the team, with Dr. Janette Martin and the rest of the obesity management team, including Dr. Ranga.
You can find me here at Centerville Medical Clinic, upstairs, right across the hall from the main clinic. But I'm attached to the clinic itself.
Okay.
And so my number here is 302-3256, and the Doctors Hospital cell is 816-7660. So that's where you can find me. I just want to add to that, family support and friendship support is extremely important when working with any chronic illness, and assisting people to self-manage whatever condition they have.
Oh, thank you so much for the numbers. Thank you, Dr. Davis-Simmons, again, for the ways to get in contact. I think we can also, if anyone wants to book an appointment, they can also email clinics.doctorshosp.com. That's clinics.doctorshosp.com. Thank you, ladies, for being here with us. On behalf of myself and producer Gally, thank you for tuning in to the Doctors Hospital podcast. Be sure to tune in to the next episode. And remember, at Doctors Hospital Health System, we care by providing the best care now. Thank you, everyone.
Introducing the K. Larry Carroll Advanced Imaging Center at Doctors Hospital, your premier destination for cutting-edge imaging services. We're proud to introduce the island's only advanced 128-slice CT scanner and advanced 3T MRI, setting new standards in diagnostic accuracy at the lowest prices. Trust our comprehensive diagnostics 24/7 and easily access your results through our user-friendly patient portal. Doctors Hospital Imaging, now available at Doctors Hospital West and coming soon to Village Road. Call 302-4662 to book an appointment today.